Compare and contrast quantitative and qualitative research methodologies in medical imaging. What are the strengths and weaknesses of each in the context of developing clinical protocols? Answer: quantitative research methodologies involve structured data collection methods that produce numerical data which can be statistically analyzed. They are particularly useful in establishing causation and generalizing results across populations. In medical imaging, quantitative studies can assess the effectiveness of imaging techniques in diagnosing conditions, enabling comparisons of diagnostic accuracy among different imaging modalities. Strengths: objectivity and reliability of data, ability to conduct statistical analyses to validate findings, generalizability of results. Weaknesses: may overlook patient experiences or contextual factors, limited ability to explore complex phenomena in depth. Qualitative research methodologies focus on understanding patient experiences, behaviors, and the context of care through interviews, focus groups, and observations. In developing clinical protocols, qualitative studies can reveal insights into patient preferences and perceptions regarding imaging procedures. Strengths: rich, detailed data that provides context, greater understanding of patient needs and experiences. Weaknesses: subjectivity can lead to bias. Findings may not be generalizable. Both methodologies are vital. Quantitative studies validate clinical practices, while qualitative studies ensure they align with patient needs. Discuss the key components of critically appraising a research study in the field of medical imaging. How can a medical radiation technologist ensure they are applying high-quality evidence to clinical practice? Answer: critical appraisal involves evaluating a research study's validity, reliability, and applicability. Key components include study design. Assess whether the study's design is appropriate for the research question. Randomized controlled trials (RETS) provide higher evidence levels compared to observational studies. Sample size and selection. Examine if the sample size is adequate and if the selection process minimizes bias. Larger, randomized samples enhance the validity of the findings. Outcome measures. Evaluate whether the outcome measures are relevant and clearly defined. Are they clinically significant? Statistical analysis. Assess the appropriateness of the statistical methods used and whether they support the conclusions drawn. Results interpretation. Ensure that the authors interpret the results within the context of the study limitations and acknowledge any potential biases. Medical radiation technologists can apply high-quality evidence by engaging in continuous education to stay updated on the latest research, participating in peer-reviewed journal clubs to discuss and evaluate current studies, collaborating with interdisciplinary teams to integrate findings into clinical protocols effectively. Mr. Smith, a 65-year-old patient with a history of chronic obstructive pulmonary disease (COPD), is scheduled for a CT scan of the chest. He expresses concerns about the radiation exposure and its effects on his condition. How should the medical radiation technologist address his concerns while ensuring appropriate imaging protocol? Answer: in this scenario, the medical radiation technologist should provide information, explain the necessity of the CT scan in diagnosing his condition and the potential benefits outweighing the risks of radiation exposure. Discuss protocols. Inform Mr. Smith about the specific imaging protocols being used, emphasizing any dose reduction techniques employed, such as iterative reconstruction or low-dose protocols. Address concerns. Validate his concerns regarding radiation exposure. Discuss the principle of ALAI as low as reasonably achievable that guides radiation safety in imaging practices. Evaluate alternatives. If applicable, discuss possible alternative imaging modalities that may pose less risk, such as ultrasound or MRI, depending on clinical indications. Inform consent. Ensure that Mr. Smith has the opportunity to ask questions and provide informed consent for the procedure after understanding the rationale and associated risks. By providing clear information and showing empathy, the technologist can enhance the patient's understanding and comfort level regarding the procedure. What role does a medical radiation technologist play in implementing quality improvement initiatives within an imaging department? Provide examples of strategies that can be utilized. Answer: medical radiation technologists are integral to quality improvement initiatives, ensuring the delivery of high-quality patient care and optimizing imaging practices. Their roles include monitoring and assessing outcomes. Technologists can collect data on imaging outcomes and patient satisfaction, analyzing trends to identify areas for improvement. Implementing protocols. They can assist in developing and refining evidence-based imaging protocols tailored to specific clinical needs, such as optimizing imaging parameters for diverse patient populations. Training and education. Technologists can lead training sessions for staff on new technologies or protocols, ensuring everyone is equipped with the latest knowledge and practices. Participating in audits. Engaging in regular audits of imaging practices can help identify inconsistencies or areas where patient safety could be enhanced. Patient feedback. Establishing mechanisms to gather patient feedback on their imaging experiences can inform future quality improvement efforts. For example, a quality improvement initiative may involve implementing a new imaging protocol for chest X-rays to reduce patient wait times while maintaining diagnostic accuracy. Explain the importance of credentialing processes for medical radiation technologists. What are the primary components involved in this process, and how does it impact patient care? Answer: credentialing processes ensure that medical radiation technologists possess the necessary qualifications, skills, and competencies to provide safe and effective care. Key components include verification of qualifications. This involves confirming educational credentials, certifications, and relevant experience. Regulatory bodies, such as the American Registry of Radiologic Technologists, set standards for certification and continuing education. Background checks. Conducting thorough background checks helps ensure that practitioners have no disqualifying criminal history or professional misconduct. Continuing education. Ongoing professional development is essential for maintaining competency. Credentialing processes often require technologists to complete a specified number of continuing education credits periodically. Competency assessments. Assessments may include skills evaluations, peer reviews, and direct observation to ensure that technologists meet clinical practice standards. The impact on patient care is significant. Credentialing ensures that patients receive care from qualified professionals, enhancing patient safety and fostering trust in the healthcare system. Analyze the impact of legislation on the practice of medical radiation technology. What key laws should technologists be aware of, particularly concerning patient privacy and data protection? Answer: legislation significantly shapes the practice of medical radiation technology, ensuring patient safety and protecting rights. Key laws include Health Insurance Portability and Accountability Act, HIPAA. HIPAA governs the privacy and security of patient information. Medical radiation technologists must ensure that patient records, including imaging studies, are confidential and shared only with authorized personnel. Radiation Control for Health and Safety Act. This federal law regulates the manufacture and use of radiation-emitting electronic products, including imaging devices. Compliance ensures that equipment meets safety standards to protect patients and staff from unnecessary exposure. State regulations. Many states have specific laws governing medical imaging practices, including licensure requirements, continuing education mandates, and safety protocols. Technologists must be familiar with their state regulations to practice legally and ethically. Patient safety laws. Various laws focus on improving patient safety in healthcare settings. Technologists should stay informed about legislative changes affecting patient care protocols and safety measures in imaging departments. How can case studies be used effectively to enhance clinical decision-making in medical imaging? Provide an example of how a case study could inform imaging protocol development. Answer: case studies are powerful tools for enhancing clinical decision-making as they provide real-world examples that integrate patient history, imaging findings, and clinical outcomes. They allow technologists and radiologists to evaluate complex scenarios and learn from previous experiences. Example: consider a case study involving a patient with suspected pulmonary embolism, P. The study may detail the imaging findings from a CT pulmonary angiogram, correlating the results with clinical symptoms, laboratory tests, and patient history. By analyzing this case, medical radiation technologists can identify imaging protocols that yielded accurate diagnoses, understand the importance of specific imaging techniques, such as the use of contrast agents in enhancing vascular structures, learn about patient positioning and preparation that optimize image quality and diagnostic accuracy. Incorporating lessons from this case into protocol development can lead to standardized practices that improve patient outcomes in similar clinical scenarios. Discuss the importance of reflective practice in the career of a medical radiation technologist. How can technologists implement reflective strategies to improve their professional practice? Answer: reflective practice is crucial for medical radiation technologists as it promotes self-assessment and continuous improvement. By reflecting on their experiences, technologists can identify strengths and weaknesses in their practice, fostering professional growth. Implementation strategies. Journaling. Keeping a professional journal allows technologists to document daily experiences, challenges, and lessons learned. This practice promotes awareness of recurring themes and areas for improvement. Paid discussions, regularly discussing cases and experiences with colleagues encourages the sharing of knowledge and insights leading to enhanced clinical practice. Feedback mechanisms, actively seeking feedback from peers, supervisors, and patients can provide valuable perspectives on performance, encouraging a culture of openness and improvement. Continuing education, engaging in ongoing education through workshops, seminars, or online courses reinforces reflective practice by exposing technologists to new concepts and practices. Explain the roles of various regulatory bodies in overseeing medical imaging practices. How do these organizations contribute to the safety and quality of patient care? Answer. Regulatory bodies play critical roles in overseeing medical imaging practices to ensure safety, quality, and compliance with legal standards. Key functions include setting standards. Organizations such as the American College of Radiology (ACA) and the Radiological Society of North America (ARSNA) establish practice standards, guidelines, and protocols that guide imaging practices, ensuring they are evidence-based and aligned with current research. Accreditation. Regulatory bodies like the Joint Commission and the National Accreditation Program for Breast Centers (NAP) provide accreditation to imaging facilities, assessing compliance with safety, quality, and operational standards. Licensing and certification. Agencies including the ARRT and state licensing boards manage certification processes for medical radiation technologists, ensuring practitioners meet educational and ethical standards. Regulatory compliance. Regulatory bodies monitor compliance with federal and state laws related to radiation safety, patient privacy, and quality assurance in imaging practices, enforcing accountability among healthcare providers. What factors should be considered when developing imaging protocols for specific patient needs? Provide a detailed example of how patient history influences protocol customization. Answer. Developing imaging protocols requires consideration of various factors to ensure that the protocols meet the specific needs of individual patients. Key considerations include patient history. Understanding the patient's medical history, including previous imaging studies, comorbidities, and allergies, is crucial. For instance, a patient with a history of renal impairment may require adjusted protocols when using iodinated contrast agents to avoid nephrotoxicity. Clinical indications. The protocol should align with the clinical question being addressed. For example, if a physician suspects a tumor, the protocol may need to focus on specific imaging planes and sequences that enhance the visibility of lesions. Patient comfort and safety. Considerations for patient comfort, e.g., claustrophobia MRI, and safety, e.g., the potential for allergic reactions to contrast should guide protocol development. Technological capabilities. The specific imaging equipment's capabilities and limitations will impact protocol decisions. For instance, newer CT machines may allow for low radiation doses while maintaining image quality. Example, a 50-year-old female patient with a history of thyroid cancer is scheduled for a follow-up CT scan. Given her previous treatment and potential for radiation exposure, the technologist customizes the protocol to use a low-dose CT technique while ensuring adequate image quality. Apply a pre-scan hydration protocol to minimize renal risk from contrast use. Adapt imaging planes to focus on areas of previous concern while minimizing exposure to healthy tissues. By considering these factors, technologists can develop effective, patient-centered imaging protocols that maximize diagnostic efficacy while prioritizing safety. What are the biological effects of ionizing radiation, and how do they differ between deterministic and stochastic effects? Answer. Ionizing radiation can cause biological effects at the cellular and tissue levels. The effects can be classified into two categories. Deterministic effects. These are effects that have a threshold dose and increase in severity with increasing dose. Examples include skin burns, cataracts, and radiation sickness. The severity of the effect is predictable and is related to the dose received. A well-known example is the development of acute radiation syndrome (ARS) in individuals exposed to doses above 1 Gi 100 rad. Stochastic effects. These effects occur without a threshold dose, and the probability of occurrence increases with the dose. They include long-term effects like cancer and genetic mutations. The relationship between dose and effect is not linear, leading to the linear non-threshold model (LNT), which suggests that any amount of radiation has the potential to cause harm, particularly in terms of cancer risk. Regulatory agencies such as the International Commission on Radiological Protection (ICA) provide guidelines on acceptable exposure levels to minimize these risks. Mr. Thompson is a radiologic technologist who has been exposed to radiation while conducting an imaging procedure. He is concerned about the long-term effects of this exposure. What principles of radiation protection should Mr. Thompson consider to minimize his risk of radiation-related health issues? Answer: Mr. Thompson should adhere to the three fundamental principles of radiation protection: justification, optimization, and limitation. Justification: any exposure to radiation must be justified by the benefits outweighing the risks. For example, every imaging procedure should be necessary for diagnosis or treatment. Optimization: this involves keeping radiation exposure as low as reasonably achievable. ALARA. Mr. Thompson can optimize his practices by using protective equipment, maintaining appropriate distances from the radiation source, and using shielding devices effectively. Limitation: regulatory bodies set dose limits for occupational exposure. For example, the ICRP recommends an annual dose limit of 20 MSV for radiation workers, averaged over 5 years, with no single year exceeding 50 MSV. Mr. Thompson should monitor his cumulative exposure and ensure it stays within these guidelines. By following these principles, Mr. Thompson can effectively manage his risk of radiation exposure. Explain the significance of dose-response relationships in radiation biology. How do linear and nonlinear models apply to these relationships? Answer: dose-response relationships in radiation biology are critical for understanding how varying levels of radiation exposure impact biological systems. Linear models. The linear dose-response model assumes that the risk of an effect increases proportionally with dose, suggesting that even low doses carry some risk. This model is commonly applied in assessing cancer risk, leading to the linear non-threshold LNT hypothesis, which posits that any radiation dose increases cancer risk. Nonlinear models. These models indicate that the response to radiation does not increase linearly with dose. For instance, certain biological effects may only manifest above a certain threshold, which means that low doses may be considered harmless. An example is the threshold dose for cataract formation, where exposure below a specific level does not result in any observable damage. Understanding these models helps radiation technologists and medical professionals assess the risks associated with radiation exposure and implement safety protocols effectively. Discuss the role of cellular responses to radiation exposure and the mechanisms involved in DNA damage repair. Answer: when cells are exposed to ionizing radiation, the most critical damage occurs at the DNA level. Types of damage. Radiation can cause direct DNA damage, such as single-strand breaks (SABS) and double-strand breaks (DABS). DSES are particularly lethal because they can lead to chromosomal aberrations and mutations. Cellular responses. Cells have evolved several mechanisms to respond to and repair DNA damage, including repair pathways. These include homologous recombination (HR) or DSBS, which uses a sister chromatid as a template, and non-homologous end joining (NHEDG), which directly ligates the broken ends. Cell cycle checkpoints. Cells can halt the cell cycle to allow for DNA repair before proceeding with division. Checkpoint proteins EGP play a vital role in determining whether a cell can continue dividing or must undergo apoptosis if the damage is irreparable. Significance. The efficiency of these repair mechanisms can determine a cell's fate following radiation exposure. Failure in repair can lead to mutations, cancer, or cell death, emphasizing the importance of understanding these processes in radiation biology. What are the public and occupational exposure guidelines for radiation, and how do they differ? Answer: public and occupational exposure guidelines are established to protect individuals from the harmful effects of ionizing radiation, but they differ significantly in terms of allowable exposure levels. Occupational exposure guidelines. The ICRP recommends an annual dose limit of 20 MSV for radiation workers, averaged over 5 years, with no single year exceeding 50 MSV. This higher limit acknowledges the necessity of radiation exposure in certain professions while ensuring adequate safety measures are in place. Public exposure guidelines. For the general public, the recommended annual dose limit is significantly lower, typically around 1 MSV, excluding natural background radiation and medical exposures. This lower limit reflects the need for strict protection due to the non-occupational nature of the exposure and the vulnerability of the population. These guidelines are based on risk assessments that consider the biological effects of radiation and aim to minimize the risk of both deterministic and stochastic effects. Mr. Lee works in a hospital's radiology department and has noticed an increase in accidental radiation exposures. What protocols should be in place for emergency responses to radiation incidents? Answer: in case of accidental radiation exposure, Mr. Lee should ensure the following protocols are in place. Immediate response. The first step is to assess the situation and ensure safety. Personnel should evacuate the area if necessary and limit exposure to others. Medical attention. Affected individuals should receive immediate medical evaluation and care. This includes assessing the extent of exposure and any symptoms exhibited. Decontamination procedures. If contamination occurs, the following procedures should be implemented. Remove contaminated clothing and wash the skin with soap and water to remove radioactive particles. Utilize appropriate personal protective equipment (PPE) to avoid further exposure during the decontamination process. Reporting and documentation. All incidents must be reported to the Radiation Safety Officer (RSO) and documented for regulatory compliance and further investigation. This documentation should include the time, location, type of radiation involved, and actions taken. Follow-up. A follow-up plan should be established to monitor the health of individuals involved and provide additional support if necessary. These protocols are essential for minimizing the impact of radiation incidents and ensuring the safety of healthcare workers and patients. How do threshold doses impact the understanding of radiation exposure risk, and what significance do they hold in radiation protection? Answer: threshold doses are critical in understanding radiation exposure risk because they indicate the minimum level of exposure that is expected to cause an observable effect. Deterministic effects. For deterministic effects, such as skin erythema or radiation-induced cataracts, a threshold dose must be exceeded for the effect to occur. For example, cataracts typically develop after doses greater than 2 Gi. Understanding these thresholds helps in establishing safe exposure limits in both occupational and public health contexts. Stochastic effects. Conversely, stochastic effects, e.g., cancer risk, do not have a known threshold, with even low doses can increase the probability of occurrence. This distinction is essential for radiation safety practices as it leads to different approaches to exposure management. Regulatory implications. Regulatory bodies such as the ICRP and National Council on Radiation Protection (SRP) use threshold doses to inform guidelines and safety standards, emphasizing the importance of minimizing exposures to levels well below these thresholds to protect against both deterministic and stochastic effects. What are the emergency response protocols for accidental radiation exposure, and how do they differ from routine radiation safety procedures? Answer: emergency response protocols for accidental radiation exposure are distinct from routine safety procedures in their focus on immediate action and risk mitigation. Key components include assessment of the incident. Quickly evaluate the situation to determine the extent of exposure and risk to personnel and patients. Medical emergency response. Initiate medical protocols for affected individuals, which may include monitoring vital signs, administering appropriate medical interventions, and decontaminating if necessary. Containment and control. Establish control over the affected area to prevent further exposure. This may involve setting up barriers, alerting the radiation safety officer, and notifying emergency services. Reporting procedures. Document the incident in detail, including the nature of the exposure, the response initiated, and any injuries sustained. This documentation is crucial for regulatory compliance and for reviewing procedures post-incident. Post-incident review. Conduct a review of the incident to analyze the response and improve future protocols. This may involve updating training programs, refining emergency plans, and enhancing equipment readiness. Explain the principles of radiation protection and how they guide the management of public and occupational radiation exposure. Answer: radiation protection is governed by 3 fundamental principles: justification, optimization, and limitation. These principles are crucial in managing both public and occupational radiation exposure. Justification. Before any radiation exposure occurs, it must be justified by demonstrating that the benefits outweigh the risks. For example, diagnostic imaging must be necessary for patient care. Optimization, ALARA. The principle of keeping exposures as low as reasonably achievable, ALARA, applies to all scenarios. This involves using the least amount of radiation necessary to achieve the required medical outcome. Radiation technologists should implement shielding, increase distances, and minimize time spent near the source of radiation to adhere to this principle. Limitation. Regulatory bodies impose dose limits to prevent overexposure. For instance, occupational limits for radiation workers are typically higher than those for the general public due to the nature of their work. The ICAP's recommendations play a significant role in setting these standards. Describe the cellular mechanisms involved in the repair of DNA damage caused by ionizing radiation and the implications of failure in these mechanisms. Answer: Cells have several mechanisms to repair DNA damage induced by ionizing radiation, which can be critical in maintaining cellular integrity. Repair mechanisms. Homologous recombination (HO). This repair pathway is primarily active in the S and G phases of the cell cycle and uses a sister chromatid as a template to accurately re-ASBS non-homologous end joining (NHEJ). This process is quicker and can occur at any stage of the cell cycle, directly ligating the broken DNA ends. While it is efficient, it may lead to errors if the ends are not perfectly aligned, potentially causing mutations. Cell cycle checkpoints. Cells can pause the cell cycle to allow for repair before division. Key proteins involved in this process, such as P, determine whether a cell with DNA damage should repair itself, undergo apoptosis, or continue through the cell cycle. Implications of repair failure. When these repair mechanisms fail, cells may accumulate mutations, leading to various consequences, including cell death, tumorigenesis, or genetic instability. The relationship between radiation exposure and cancer risk underscores the importance of these repair processes in radiation biology. Explain the difference between film screen systems and digital imaging in X-ray imaging. What are the advantages of digital imaging over traditional film screen systems? Answer. Film screen systems use film that is sensitive to X-rays to create an image, while digital imaging employs electronic sensors such as CCD or CMOS to capture the image and convert it into a digital format. Advantages of digital imaging include image storage and retrieval. Digital images can be easily stored, retrieved, and shared electronically, eliminating the need for physical storage and reducing the risk of image loss. Post-processing capabilities. Digital images can be manipulated, e.g., contrast adjustment, zooming after acquisition, enhancing diagnostic accuracy. Reduced radiation exposure. Digital detectors often require less radiation to produce a diagnostic image compared to film screen systems. Improved image quality. Digital imaging often provides greater detail and contrast resolution, leading to better diagnostic capabilities. What are the primary components of a CT scanner, and how do they contribute to the imaging process? Answer. The main components of a CT scanner include X-ray tube, produces X-rays that penetrate the body. Detectors capture the X-rays that pass through the body and convert them into electrical signals. Gantry houses the X-ray tube and detectors. It rotates around the patient to acquire images from multiple angles. Computer system processes the electrical signals to reconstruct images using algorithms, e.g., filter back projection. These components work together to produce cross-sectional images of the body, allowing for detailed visualization of internal structures, which is crucial in diagnosing various conditions, especially in trauma and oncology. Mrs. Thompson is undergoing an MRI scan for suspected neurological issues. What safety considerations must the technologist ensure before proceeding with the scan? Discuss the potential risks and precautions associated with MRI procedures. Answer. Before proceeding with an MRI scan, the technologist must ensure the following safety considerations. Patient screening. Verify the patient's medical history for contraindications such as the presence of pacemakers, metal implants, or claustrophobia. Informed consent. Explain the procedure, including its purpose and any potential risks, and obtain informed consent. Monitoring allergies. Assess for allergies to contrast media if applicable. Environmental safety. Ensure the MRI suite is free from ferromagnetic objects to prevent accidents. Emergency protocols. Be prepared with emergency procedures in case of adverse reactions or equipment malfunction. Potential risks and precautions. Heating of implants. Some implants may heat during the scan, posing a risk to the patient. Contrast reactions. Rare allergic reactions to gadolinium-based contrast agents can occur, necessitating a preparedness plan. Discuss the principles of ultrasound physics and how sound waves are utilized to create an image. What factors affect the quality of ultrasound images? Answer. Ultrasound imaging is based on the principles of sound wave propagation. A transducer emits high-frequency sound waves, which travel through the body and reflect off tissues. The echoes are then captured by the transducer and converted into electrical signals, creating an image. Factors affecting image quality. Frequency of sound waves. Higher frequencies provide better resolution but have limited penetration, and low frequencies penetrate deeper but offer low resolution. Acoustic impedance. Variations in tissue density affect how sound waves are reflected, influencing image contrast. Angle of incidence. The angle at which sound waves strike tissue impacts the strength of the reflected echoes. Artifacts. Technical factors such as reverberation or shadowing can obscure or distort images, affecting diagnostic quality. Explain the concept of radiopharmaceuticals in nuclear medicine and their role in SP, CT, and PET imaging. What are the safety protocols associated with their use? Answer: radiopharmaceuticals are compounds that contain a radioactive isotope and are used in nuclear medicine for diagnosis and treatment. In SP, CT single photon emission computed tomography, they emit gamma rays that are detected to create 3D images of physiological processes. In PET positron emission tomography, they emit positrons, which annihilate with electrons to produce gamma rays detected for imaging metabolic activity. Safety protocols: proper handling and storage. Radiopharmaceuticals must be stored securely and handled following strict protocols to minimize exposure. Dosimetry monitoring. Technologists should monitor their radiation exposure using dosimeters. Patient education. Inform patients about the procedure and any precautions post-injection, such as hydration, to facilitate elimination of the radioactive material. Disposal of waste. Follow regulatory guidelines for the disposal of radioactive waste to prevent contamination. What are the common applications of computed tomography (CT) in trauma care? Discuss the advantages of using CT in emergency settings. Answer: common applications of CT in trauma care include head injuries, assessing for intracranial hemorrhage or skull fractures, abdominal injuries, identifying organ damage, hemorrhage, or vascular injuries, spinal injuries, evaluating fractures or spinal cord injuries. Advantages of CT in emergency settings: rapid acquisition. CT scans can be performed quickly, providing immediate results critical in trauma scenarios. Comprehensive assessment. CT can evaluate multiple body systems simultaneously, aiding in the identification of concomitant injuries. High sensitivity. CT has a high sensitivity for detecting bleeding and fractures, allowing for timely interventions. Describe the reconstruction algorithms used in CT imaging, specifically focusing on filter back projection. How does this algorithm improve image quality? Answer: filter back projection (FBP) is a widely used reconstruction algorithm in CT imaging. It involves the following steps: projection data collection. X-ray attenuation data is collected from multiple angles around the patient. Filtering. A filter is applied to the projection data to reduce noise and enhance edges before back projection. Back projection. The filter data is then back projected onto a grid to reconstruct the cross-sectional image. Improvement of image quality. Noise reduction. The filtering step helps remove high-frequency noise, resulting in clearer images. Edge enhancement. FBP sharpens edges, making it easier to delineate structures and abnormalities. Mr. Carter is scheduled for an abdominal ultrasound but expresses concerns about the procedure's safety. As a medical radiation technologist, how should you address his concerns and explain the procedure's safety measures? Answer: to address Mr. Carter's concerns, I would provide information, explain that ultrasound uses non-ionizing sound waves, making it a safe imaging modality with no known harmful effects. Discuss safety measures, reassure him that ultrasound has no radiation exposure and that technologists follow strict protocols to ensure patient safety. Answer questions, encourage him to ask any specific questions he might have about the procedure, including the preparation and what to expect during the scan. Highlight benefits, emphasize that ultrasound is a valuable tool for diagnosing various conditions without the risks associated with ionizing radiation. What safety protocols should be implemented in a nuclear medicine department to protect patients and staff from radiation exposure? Answer: safety protocols in a nuclear medicine department include patient education, inform patients about the procedure, expected radiation dose, and post-procedure care. Time, distance, and shielding. Minimize time spent near radioactive materials, maximize distance from sources of radiation, and use appropriate shielding. Lead barriers where necessary. Personal protective equipment (PPE). Use gloves, lab coats, and eye protection when handling radiopharmaceuticals. Regular monitoring. Implement regular monitoring of staff radiation exposure using dosimeters and conduct routine audits of radiation safety practices. Emergency procedures. Establish clear emergency procedures in case of spills or accidental exposure. Discuss the clinical significance of artifacts in ultrasound imaging. What types of artifacts can occur and how can they impact diagnostic interpretation? Answer: artifacts in ultrasound imaging are discrepancies between the displayed image and the actual anatomy, often caused by technical factors or patient conditions. Common types of artifacts: reverberation artifacts, caused by multiple reflections of sound waves, leading to false echoes and duplicated structures. Shadowing occurs when sound waves are absorbed by dense structures like bone, obscuring deeper tissues. Enhancement artifacts, occur beneath fluid-filled structures, leading to a brighter appearance of underlying tissues. Mirror image artifact caused by sound waves reflecting off a strong reflector, creating a duplicate image. Impact on diagnostic interpretation. Artifacts can lead to misdiagnosis by mimicking pathology or obscuring true abnormalities. Radiologists must be aware of these artifacts and apply critical thinking to differentiate between genuine findings and artifacts, ensuring accurate diagnosis and patient management.